Good morning and thank you very much for joining us. I am Yori Folari. My guest this morning, one of them is Dr. Omadeli Boyo. He's a public health expert consultant. Thank you very much for coming on, Doctor. It's been quite a while, but we see you remotely more than anything. So it's good to have you in the flesh, so to speak. We'll also be joined by Dr. Nneka Onwu, and that's the Director, Primary Healthcare Systems Development. You might also know it as NPHCDA. We'll also be joined by Dr. Nneka later on. You might have heard the news. First of all, it had occurred to me that our society in Lagos, I can only speak of where I'm from, where I happen to be situated at right now, not that I'm from Lagos, we're carrying on as if everything is normal, back to normal. It is the rare person who is still wearing a mask, a nose mask, the way we were told to wear it back in the day, and everybody took quite seriously. Establishments have relaxed a bit. You know how it is. Even establishments where you see the little sign, no mask, no entry, test it out. Don't wear a mask and try to gain access. I guarantee that in something like 8 out of 10, you will actually be able to make it. So the news that Nigeria is now planning to look at a better way, a faster way of spreading the vaccines, getting us up to herd immunity. As of the moment, the doctors and official statistics say that we're slightly under 3% in terms of our coverage of our population that are eligible. Just 2.9%. And so we're going to have to get, what, 101? Is it 101 or 111 or 111? Dr. Boyo, these are the figures. And we have to do that by January, if I'm right, next year. It seems that, first of all, would you like to comment, please, on my observations that society, at least in the Southwest, Lagos Southwest, where we're broadcasting from, you've observed that parties are back to normal every weekend. All sorts of mass events are going on. What do you think accounts for this? Because nobody sounded the clear that everything is clear now. You can go back to your lives.
Yes, but that's because right from the outset, when there was a lockdown, it was only mainly Lagos and Abuja that even observed these things. So the other parts of the country never did. And when they did so in isolation, isolated places. So it's true, people have already thrown caution to the winds. And that's because also the economy of Lagos depends so much on private enterprise, events and things like that. And I think people are very wary of going in and saying, stop this, because people in Lagos like to party, they like to go for week keepings and things like that.
But
so
people in Lagos, I would imagine, also like to be alive.
They want to be alive, but let's start from the beginning. Do people really believe there was COVID in the first place? That's the first thing. Most people have doubted the origin, the presence of COVID, and that's why each time we talk about vaccination, the first thing that comes to my mind is testing and maintaining the same things we have been doing, physical distancing, masking up, washing our hands, and things like that, and staying away from large crowds. Now, testing, in most parts of the world, testing should come before vaccination. We should be having free testings in pharmacies, in hospitals, all over the country. So if you have these symptoms, you go straight and get tested. In fact, in a company like this, in universities, students will be tested on admission. Every month, all students in universities, secondary schools, above the age of maybe 15, should get tested. But when this testing is not done, people do not know they're positive. So things you are treating for malaria could have been COVID. If people know that they are COVID positive, people will not be afraid. They will not take precautions. But testing is minimal. They were talking about vaccination of 2.9%.
In our parts here, it costs money.
Testing is not money. Free. Vaccination is not free either. The government is investing in vaccinations. The state government, Lagos State was doing testing free.
It's not free either.
But government is investing in it. Yes, it's free.
Oh, okay.
It's free. Yeah. But if we could pump that kind of money to vaccination, I would have loved us to have pumped the money into testing, because the myth that there is no COVID-19 in Nigeria will be broken. Once we find out that my brother tested positive, and my this tested positive, begin to isolate, household isolation, people will get to know that this thing is in the country. But when there are no testings, or where testings even occur, we even have people having fake testing results, fake test results, traveling out of the country. So we need to go back to the basics. Enforce masking and physical distancing, washing our hands, and coming against large crowds. There's no point vaccinating 50, herd immunity is 70%. 70% of 200 million is 140 million. We're not targeting 111. If after the key critical time of COVID, we could only vaccinate 2.9%. Now that people believe that COVID has left, they say it in churches, they say it in gatherings, COVID is not in Nigeria, it has left. What will be the motivation to take the vaccination?
Which was, and that is the big question. Maybe, well, the motivation.
Yes, for the vaccination.
Well, apparently, I don't know about the motivation, but government seems to have seen that there's, an emergency waiting to happen if we don't, massively
that came from the fact that those that even had the vaccinations, they came down, especially the elderly, people with comorbidities, they came down with COVID. And thank God for the vaccination. That's why some of them survived this. And bad people have even died. Now, this also is bringing to mind some Nigerians saying, after all, those that took the vaccinations are dying. Are you getting my point? So we need to come out of this vaccination hysteria and think of testing.
I hear you, but to address some of the things you said, from the beginning, experts had always told us that, look, it does not mean that you will not catch COVID even when you've had a full dose of vaccination. It does mean, however, that you're going to have a much easier time at it and recovering. In other words, if you were to catch COVID-19 without any vaccination, it's going to be a life or death struggle.
So even if you don't die, the sequelae, the complication of COVID is quite scary. That nobody wants to have it.
Indeed.
So even if you don't die, you've gone through isolation, gone through intubation, gone through ventilator. When you come out, you run to Agbolon Loga because it will be so terrible an experience. So that having the vaccination prevents you from those scary moments also. But then you can have the vaccination and be positive. You can have the vaccination and be positive and don't get into becoming symptomatic. You see that? So when you are positive and you're not symptomatic, you're also a carrier.
Exactly.
That is why testing is important everywhere. In fact, before you get admitted, before you sign into university for your semester, you'll be tested. You'll be tested. Yes. In the state they are abroad now, where the Premier League and other leagues are taking, they test people. Even though they are vaccinated 70%, they still test people. And if you are playing football and you test positive, you are pulled out. You are pulled out because you can infect somebody else.
And you see, and talking about, well, two things, can't say both of them at the same time. But the other thing is that even in the West, and you're just talking about their attitude to it and the strides, the gains they have made in terms of the percentages of their population. Take the UK, for example. Now, the UK, for example, maybe other countries as well, are thinking of vaccinating even people that were not originally in the catchment area, youngsters.
Children, yes.
Children, going as far as, look, you know what? We think we can go for the children. That's on the one hand, but I said I was conflicted. There were two things that I wanted to talk about. That is one of them. The other is, I wonder what your thoughts would be on the notion that COVID-19 cannot survive in Nigeria. And that is why we're having this easy time. I asked this question against the backdrop of the empirical knowledge that we have had a much better time in COVID in Africa than in the West. And so people are concluding that there are all sorts of reasons, the sun, the tropical temperature. Would you like to see if you could address that? I know I mismatched questions.
It's okay. Well, what a better time in inverted commas, because we don't keep statistics of death all over the country. And I can tell you as a practicing doctor that we have a lot of cases of people that run temperature that don't respond to even chloroquine, the various anti-malarials like the artesunate and lumefantrine. And people are now asking ourselves, if you tell them to go for testing from private hospital or general hospital, they can't afford testing of 50,400 naira. What when they don't even have the money for the drug? So the mere fact that we are not picking up the people that are positive gives us the impression that this thing is not here.
Okay.
And two,
so we're actually underreporting.
we're underreporting incidents. And two, we don't know even our death profile. People just say people are dying. We don't know how many people are dying. Are we keeping records in various parts of the country? What I can tell you is that we don't, from the medical perspective, we don't seem to have a pandemic or an epidemic of deaths in many places. We still have people dying, yes, but it's not like a proportion of an epidemic for us to shout out for. But then it's better to err on the side of caution.
Indeed.
And say, let's make sure. Even Australia, just picking one positive person makes them to close down a whole suburb. They track you to the last person and they pick you out. Why? Because this thing is devastating.
Now, perhaps we don't have the funds, dare I say it, organization to achieve similar procedures.
Yeah, but the funds to test, if we have funds to go to COVAX, that's the multilateral organization that brings in the vaccine, why can't you even meet them to talk about getting testing? Because most Nigerians will eagerly go for testing than vaccination. There are many rumors about the vaccination affecting your DNA, your RNA. It could make you die in 5 years. But the testing, people are ready to do the testing. Why don't you give people what we know? That's what we do in public health, community medicine. You ask for what people will like. You ask people what they need and what they want. Most people will tell you we want to be tested so we can know our status. But you are bringing vaccines and telling people get vaccinated. They tell you that I don't have this thing. It's not even in my family. It's not in the country. Why are you vaccinating me? So we have turned the pyramid, the cone upside down, giving our time more to people that we want to pull the vaccine and get 50% of the population vaccinated. When you don't even have the number of people that are tested, not even up to 0.1% tested, but you want to give 50% vaccination. They will tell you don't want. People are rejecting the vaccines because, one, they don't believe this thing exists. Prove to them it exists by testing them and letting them know it is COVID you have and not malaria, not the flu. Then they begin to rush for the vaccine.
You know, Doctor, what you're saying makes perfect sense to me, but you concede that your colleagues, your professional colleagues, also are in the government formations that are dealing with this pandemic. Why do you think they also are not seeing it evidently like this? Otherwise, this wouldn't have been announced, wouldn't have announced that this is the way we're going. This other aspect of it that you're pointing out, that why aren't we testing? That is really the key. Why do you think government doctors, if I should call them that, but your colleagues in there are not also advising, if you want, the policymakers that that's the way to go?
Yes, they won't do that because, see, the vaccines seem to be a bit more lucrative than testing. When you test, you bring the testing kits to the country and you're going to give to maybe pharmacies, give to hospitals to do testing free of charge, like HIV testing. Once you begin to do that, you begin to ask yourself, where are we going to make some money? You know, but bringing in vaccines, it's pushed on you by the multilateral organization because they know that if you get vaccinated, you can travel. If you get vaccinated, you can travel. It's in the interest of the international organization like the US and Europe and WHO to even push the vaccinations to people, because they will say, oh, you are vaccinated, you can come to our country. But the truth is, if you are living in the country, get tested. And most of those countries that are even vaccinating have tested over and over again. Some people have tested 10 times. In some countries like Australia, every hospital staff gets tested twice a month. Can you imagine that? Okay. Twice a month.
Let me hear from Dr. Nneka Onwu now, Director, Primary Health Care Systems Development, based in Abuja. Good morning to you, Dr. Onwu.
Good morning.
Thank you very much for making time for us this morning. I'm in studio with Dr. Omadeli Boyo, public health expert and consultant. And in Abuja, we've been talking about the attitude observed, especially in the southwest, in Lagos in particular, where we're broadcasting from. The people seem to be carrying on as if COVID is a thing of the past. All the public precautions that doctors, directed at the time, very few of those are still being observed. What is your observation in Abuja? Is it any better? Are people still carrying on as if we're in a serious pandemic that nobody has said is over?
I think globally it's still a challenge. Globally it's still a challenge in terms of Sorry, I can't.
Well, we can hear you.
It's a challenge in terms of. Okay, thank you very much. Globally, it's still a challenge, to get people to wear the mask. But initially, I think there was that people were not sure there was COVID. And what we are seeing now and what is happening, they find that COVID is real. I heard Dr. Boyo talking about, what people thought before in terms of it's not going to come to Africa, and then, people are going Africa to because of the sun and others. But they found out that really the pandemic is here, and we're actually in the fourth wave. We might, like you talked about testing and the way we respond to health issues and most issues, but you and I know that COVID is here. We've had reports of people dying. Like you said, our reports and how we report things, I think it's culturally, people will say it's not my portion, but we have seen it, and we know close relatives who have died from COVID, so it is here. And I think with the government, through the Presidential Steering Committee, the information going out there is please, the wearing the mask, making sure that you wash your hands, and then, wear your mask, and then social distancing is important. And we have kept those advisories there. In addition, also for ceremonies and going to churches, based on our sensitization, we've continued to do that through our communication team, the risk communication team, and we sensitize people on what to do. Even within the communities, we are using our gatekeepers to tell people what to do, and making sure that they wear the mask. It might be expensive, but they can use a covering or social distancing. It is a long haul, I know, in terms of compliance, but the information is there. We're not out of the woods yet. And that is why we need to, make sure that everyone gets vaccinated. And the NPHCDA, which is an arm of government responsible for vaccination, is ramping up in the current phase, especially as we go into the season of Christmas, to see that everybody gets protected. And that is why we've commenced a mass vaccination across the country.
Dr. Onwu, the mass vaccination is scheduled to begin kick off tomorrow, I believe, Friday. This aim to achieve herd immunity, how much of a challenge do you think that is, given that we are told that 2.9% is the figure that we can quote of achievement of coverage so far of our eligible population? Now, trying to go for herd immunity, how challenging do you think that is? I was warned that the network is fluctuating a bit.
Sorry, a bit. I'm not hearing you clearly.
Okay, I can hear you now, Doctor. Let me give the question another try. I was asking how challenging you think.
I'm not hearing you at this moment. I was just.
Okay, it's a bit.
I'm not hearing you, but really, going on with my discourse.
Doctor, can you hear me now? Can you hear me now? Can you hear me now? I was asking how much of a challenge you think it is.
The audio is not coming. I apologize.
Okay, indeed. We apologize. We apologize. So we're going to wait for you to settle down a bit. In the meantime, I'll come back to studio with Dr. Omadeli Boyo. We still will see what data transmission thing will resolve, whether it will resolve itself or not, so we can continue our conversation with Dr. Nneka Onwu, Director of Primary Healthcare Systems Development in Abuja. Dr. Boyo, what would be your response to the question that I asked Dr. Onwu? Look, how much of a challenge is it now going to be? If it's 2.9% that they are quoting, and it sounds good, indeed that is desirable and something we should be desirous of, but how much of a challenge do you think it's going to be?
Huge.
Herd immunity.
Huge. Very, very big. It's like, going to the moon. Because when COVID was in the first wave, there was a lockdown and everything, people did not get vaccinated. The story out there, you see, in public health, you don't just throw things out. You sit down and ask yourself, how can we get this thing done? It's like planning, implementation, monitoring, and evaluation. So you plan it out, okay, what is public perception about this thing? How do you handle it with communication? You now know that public perception is that this thing does not exist. Where they say it's for the rich, for the elderly, but not for us. We've not seen it. Then what do? You get them to know that this thing exists by showing them pictures of pictures of isolation centers.
And then there are those plans to put out communication. Maybe government has determined that it hasn't done enough.
Friday. You want to start a mass vaccination tomorrow? Look at how long it took us to get rid of polio. Other countries have gotten rid of polio for decades. It took us so long. Why? Because of this same mechanism of just saying we are going to go out there and get everybody vaccinated. These vaccines will not get there. The reason being that people have to be completely bought over to know that this thing is necessary. And the key to this is testing. When people know that this thing is there, have tested positive, I'm isolated. Remember when my family tests positive, it stays in bedroom. We give him food without touching him. It doesn't come out for like 14 days, and then it comes out. He knows what COVID is. The average man doesn't know what COVID really. They only hear about it on television, reading the news, and it looks like a foreign disease. So I will suggest that we're going to achieve 111 million between tomorrow and the end of January. We must go out first with mass communication things. Okay. Let the newspapers, let the TV, let everybody know what is going on and why they need to do that.
One of the things that we experienced since we started getting these jabs is that it did take a bit of an effort. I mean, you had to, as you were just saying, be persuaded of the existence of COVID-1, and then 2, your responsibility to do everything that you can, both to safeguard yourself and those around you. So those kind of people went. But those that were dilly-dallying, that were on the fence, so to speak, I imagine they took advantage of all the rigmarole, if you want.
And social media fake news.
And all of that. But now, government is coming up with the methodology of, look, go out there to the chemists, go out there to the shopping malls, go out there to the clinics, private establishments, I don't know, even
motor parks.
Motor parks. Maybe hotels, everything.
Motor parks.
Go to every place.
But you really have imagined
if it's a walk-in, walk-out kind of affair.
Imagine if these things, motor parks, hotels, chemists, were being tested. I now know you can move into any chemist like you do HIV test, malaria parasite test, and say, test me for COVID. And it tests you are negative. And it tests you are positive.
And you didn't pay 50,400.
No, it's free. If you invest the money into testing, then people now know that they are negative, and we can say Nigeria is free from COVID.
Okay, let me try Dr. Onwu again. I hear that it's better now. Good morning. Hello again, Dr. Onwu.
Thank you. Good morning.
Okay. So, still in studio with Dr. Omadeli Boyo. You might have heard some of the things he said. I was asking you the question before the whole data rate sort of messed everything up. I was asking the question of how much of a challenge do you think it is to achieve herd immunity? And that seems to be the objective now.
It's a challenge in the current dispensation we are, because we intend to ramp up and reach this our target. And being a challenge, we do not produce vaccines in this country, so we depend on donations and the COVAX facility to give us vaccines. Initially, we got about 3.9 million doses, and then so far we got about 21.4 million doses, and we are using it, and as it comes, we have about a commitment of 100 million, and that is what we are going to use to reach our target. So for a country that is not producing, we are dependent on that and having the vaccines. In addition, is also making sure that everyone gets the vaccine. Based on our plan, we started with the healthcare workers, because that was the vaccines that we had earlier. About 3.9 healthcare workers, and then others, the elderly, and we have expanded to 18 to above 18 years. And now, we've ramped up. We are using more sites. We are using, our malls, like you said, the markets, anywhere we can have people, our churches, our mosques, motor parks.
Okay.
These are the places we are trying to ramp up. Any park where we can get anyone.
Oh, okay. Now, I mean, we shouldn't look a gift horse in the mouth, so to speak, but I wonder, are we making it up as we go along? That is the whole methodology that is best to adopt. Because now that is the malls, the motor parks, everywhere. Now, is it desperation on the part of government, or if you want renewed knowledge as a result of observing what has been done in the past and seeing what we can use that knowledge to produce? Because I'm imagining that if this particular methodology had been adopted since February, we might have had better coverage. What do you think is responsible for the fact that, okay, now we're quote unquote going for broke, but earlier, we seem to be tied down a bit by, logical procedures, if you want.
No, we had a plan right from the beginning. Yeah, we had a plan right from the beginning. Our plan 1.0. Yeah, we had a plan initially, and the first plan was to get the healthcare workers, and other frontline workers, and after that to expand. And the current phase was taken into consideration, as the fourth phase of the rollout. Based on the commitments of vaccines we had, we knew, because there's no way opening it up with 3.9 if you don't have enough. So we knew the vaccines we had committed and when it will come. And based on that availability, we've continued to, stick to our plan. So initial plan was to get healthcare workers, frontline workers, expand, the various phases. And we know also it coincides with this season when people are going to be traveling, a lot of traveling people coming in, and we have adequate vaccines. So this is in the plan. It's not something that we rushed out. It's been in the plan right from onset. We have the plans to expand now to public facilities, private facilities, pharmacies, and every site where we can find people, where they'll be in very, a large group of people, which, like you said, the malls, the parks, the markets, everywhere, we need to reach our people. Most of the time also, people have been saying, and I heard him say earlier, people are saying, where do we get the vaccine? We are opening it up, the vaccines are here, we know the site, the health workers have been trained, they are there, so you can walk in anywhere and get vaccinated. So your reason will not be that you don't know the site. We are publishing it on our website. It's in the papers. You know where to go. If you miss the public facility, you will miss the private facility. If you miss the private facility, you will not miss the pharmacy near you. If you miss the pharmacy, you know that you're walking into any of our big centers.
Okay.
When you shop, the shopping mall with your children, you will see. You will get, the vaccines are there. So people are there to vaccinate. So it's not a rush thing, it's part of the plan. Okay.
How about the matter of, quickly before we go on break, the matter of testing? Dr. Boyo has spoken extensively about that the one thing that seems to be important that is missing in the mix is the issue of testing, primarily because it costs 50,400. Your thoughts on that?
Okay. Actually, for the testing, the pillar NPHCDA is responsible for is the vaccines. The NCDC is responsible for that in terms of testing. And I know that when they started, the issue of testing and the cost of testing and where to be tested, I don't think it costs for the routine testing. It doesn't cost that amount of money. I think for the people who are traveling, that's the one that costs the 50,000, and I think government has looked into it and is still looking at it and making sure that they bring down the cost. There's the RDT and the PCR. The PCR is the one that costs much because of the reagents and equipment and all the processes that are required. But it's important also that we know that there are labs that are there and certified by government for people to be tested, and the testing is going on.
Okay. Thank you, Dr. Onwu. I've got to go on a commercial break now, but please stay with us if you will. And when we come back, we'll continue. Same for Dr. Omadeli Boyo in studio. We'll be right back. Please stay tuned. Okay, welcome back. Having this conversation with Dr. Nneka Onwu in Abuja, who's Director of Primary Healthcare Systems Development Authority, and Dr. Omadeli Boyo, Public Health Expert and Consultant based in Lagos here. I imagine he also moves about a bit because the public is not limited to Lagos, so there will be reasons for the public to shift from time to time. Dr. Boyo, Dr. Onwu says the testing aspect is really, in the court of NCDC. so these things are divided up, and they are governmental. They can speak to policy makers. If it is as important as you say it is, surely the medics in there need to have should have seen it as well, because we just, that's why we bring experts like you, Dr. Onwu, to help us understand these things as they go out there.
Yeah, at the beginning of this pandemic, you remember very well, we used to have a section in most newspapers that would say number tested, number positive, number deaths,
yes,
number
right.
out of the hospital. Those things are not even there anymore. We rarely see them. They come from NCDC. The problem is when testing is low, number of deaths, number of positivities will be low because you're not testing, yes. So you don't know. And that's the key thing we need to know to be able to. We are talking about mobilizing people. I'm not just saying we should do it because I produce test kits. No, we are saying that we're going to get people to see the need to be vaccinated. They must be able to see the statistics.
But Dr. Onwu was explaining that, well, it's not all testing that is expensive, but she did mention a particular type that, because of, did she say reagents? That those are the ones that might
PCR. It says that not expensive. Now, if we can invest in vaccinations, you know what it is? Some of these vaccines are minus 70 degrees centigrade, which is they're going to be preserved in very, very difficult conditions. We're able to do that. We're able to take them to the wards, to the local government headquarters, take them around the country. We're able to do all these things, and we spend money on bringing them in. Even if they are given to us by COVAX. Yes, they are given to us by COVAX, but the whole thing, syringes, needles, paying the staff to give this thing, can this part of this money be diverted to say, let's test people? In Europe now, they have what they call domestic kits.
Yeah,
you can test yourself at home.
As simply as a pregnancy test. Okay, let me ask Dr. Onwu this. Dr. Nneka Onwu, the other question I wanted to ask you is that in keeping with this effort to do our best to reach herd immunity, especially between now and the end of January, do we have the number of vaccines to go to what? Is it 111, people? 111, that would give us something of a herd immunity. Do we have the vaccines to achieve such a feat?
We have the vaccines to reach that number. Like I said earlier, we have a commitment of about 100 million doses already. So we do have the vaccines to reach this target by that time, and that is what we are hoping to do. I'm believing that people will also, get vaccinated as they hear that the vaccines are available. Like Dr. Boyo was talking, I just want to recall that in a pandemic with very high mortality, the issue of testing first and isolating will not be, the best recommendation. You must prevent people from dying, and you must get them to vaccinate, and that is the first tool and the pill we have for now to protect people. And evidence and history has shown that it's important that we get people protected as we go along and also ramp up the testing. But we do have the vaccines in the current phase, and that is why we planned it so that as we are expanding, we have the vaccines, we have trained the personnel. We actually started training the personnel right from onset, when the pandemic hit us. We started training healthcare workers to get them more confident, to get them to understand the vaccines. And that is why you can see that our facilities are now open and attending to people and providing all the care that is required. And as people, get more confident and know that the social media, rife with all kinds of news, disinformation, and getting, they know that those information is not right.
Yeah.
You may recall the one of the bulb. We came out to debunk it, and we continue to do that through the press conference from the NPHCDA, from the Honorable Minister and the PSC. If people have the right information, and they know where to go, they are taking the vaccines and they do the right thing. And people always do the right thing. It's just being informed. Unfortunately, they were getting information from the wrong sites, but now they know better. They have seen people who have been exposed with, with COVID. They have seen people vaccinated who are going about, alive and well. So therefore, I believe that these vaccines that we have, is going to be enough. And I know it is enough for us to get to that target. We plan. In our plan, we know that we have adequate vaccine, adequate resources to get to that target. Thank you.
Right. I want to thank you very much, Dr. Nneka Onwu, for joining us this morning, Director, Primary Healthcare Systems Development Authority, NPHCDA. Thank you very much, Dr. Onwu. Now, we still have to deal with this. You've explained how Information is tremendously important. You've got to inform the people. A lot of people are not informed, and Dr. Onwu sounded a note of warning there that, look, social media, your WhatsApp, Telegram, or whatever it is that you use, that's not a reliable source for information, even though stuff is being put out. But the point is, there is an absence of quality public information, and it's not a Nigerian thing either, because as you know, even in the West, all sorts of rubbish information is also circulating on social media, but perhaps their public services are doing better in terms of putting messages out.
No. We see, we cannot ignore social media. Social media is a powerful weapon now. In a country where there's no power, we can watch TV, we can listen to radio at the time we want to listen to it. We don't even have power. In a country where people there's a trust deficit between the people and the government, they will resort to social media. The job of the government right now is to ensure that they also bombard the social media space with the truth. When the truth is absent, falsehood prevails. Why do you want only falsehood to? You have all ministers have Twitter handles, they have Facebook pages, they have WhatsApp. Put up write-ups. We have universities, we have medical schools that can come up with the truth.
A lot of that is going on.
NCDC.
Yeah, they have taken very good advantage of social media. So they were out there a lot until, as you said, in recent times. At the beginning
of the pandemic, every day they address the country.
That is so.
Now they're not addressing the country every day. What does it tell you? This thing has gone down. It is no longer, you can't force, vaccination, you can't force, there's much more social media falsehood and all kinds of theories about vaccination and testing. People are afraid of these vaccines. She's saying more like, if the vaccines are available, people will come around. But we've seen the vaccine that you got 2.9% when you had the vaccines, and now you want to move from 2.9% to 50%. Overnight. Okay. It doesn't work. We should have asked ourselves, how come we had only 2.9% uptake of the vaccines? And the reason because of all these theories going on.
Mazi Okoroa, for good morning, sir. Mazi, have you joined us?
Dr. Boyo.
Okay, Mazi
Good morning.
Dr. Boyo, I want to find out from Dr. Boyo. Doctor.
Yes, sir.
Now that we are talking about this vaccine, what does it take? What does it take the government? Yeah, I'm with you. Good morning.
Please carry on. I didn't want to interrupt.
People, at least today, we have an issue about this mobile clinic. If you see that, if you go around like the primary health care center, you see people going to vaccinate for this 5 killer disease. Is it not right for government to have what we call mobile clinic? In form of this mobile thing will now go around into the local government. And as they are going there, they are testing and they are vaccinating people. And they are producing their own card that they have done the vaccination. That should be the best, because many Nigerians find it very difficult to leave their house and say they are going to the hospital or they are going to where they said they come and vaccine.
Okay, thank you very much, Mazi. Let Dr. Boyo comment on that.
Yeah. No, it's so clear. We are saying the same thing. People, there's more conspiracy theory out there against the vaccine. People don't want the vaccine because when they got the vaccinations, some of them took ill. 1. 2, they have found out that those that got the vaccines also get sick. So we are saying the vaccine is true, the vaccine is genuine, people should take the vaccine. Why don't we also come out to them and tell them, look, do the testing?
But Dr. Onwu, she had opined that that's not the way to go because of the emergency on the ground. I mean, just interpreting what she said the concern was to vaccinate as many as you can. So the systemization of it by first of all testing and then looking at that data and then proceeding to vaccination when necessary. I think the decision has been made that, look, can you just vaccinate everybody who is eligible?
All right.
And that, of course, maybe there will be some wastage.
Now, where I'm coming in here is that if you had an initial vaccination of 2.9% uptake, how do you want to move to 50%?
Okay, let me see what Ada in Jos thinks. Good morning, Madam Ada.
Good morning to Dr. Boyo and
good morning.
Dr. Nneka on online. Ada from Jos. let me look at it from this viewpoint. I hear you, doctors. You know, Mr. Yuri, the major reason for most Nigerians to drop their guard is because there's so much hunger in the land. I'm not saying it's a justifiable reason, but that is part of it. With the soaring prices of food, goods, and services, that an average Nigerian is frustrated, hungry, and angry. An angry and hungry man have no respect for law, authority, and humanity. Moreover, there are other ailments that are killing us more than COVID, e.g., cholera, TB, malaria, just to mention a few. I'm not against waging war against COVID, but my concern is that let the government of the day try to address some of this issue of hunger to enable us to eat right, to be able to boost our immune system, and be able to achieve the health immunity we're talking about. Then I'll urge my fellow Nigerians, let us observe the non-pharmaceutical protocols, whether we like it or not. COVID is real. It's not over until it's over. And the government should now bring the vaccine and the testing closer to the people. All these www, some people, when they hear this www, they just ask you which one is www. I say, I don't know, go and ask them. God bless you. Let's not give up on this country.
Well, thank you very much. Yeah, I'd recommending there that those protocols that we were told, people need to go back to them. Then people, whoever is going to go there has their work cut out for them. Have you ever been on a queue and everybody is just, they said we should give ourselves, what, 6 feet, 2 meters?
Yeah,
you know, that doesn't happen anywhere. And even when you sort of try to be as nice as possible and not speak out, but maybe just look at the person and hoping that they will catch the hint, they're looking at you as what's the problem? You know, so you see, what's the problem? You don't want to say, could you move back a bit, please? You're too close to me. You can imagine the reaction that will get you.
You see, public health is a science. It's not fiction. If you want to give a community water, you find out what they need first. If you want to give them a university and they don't have water, and water is their basic need, give them water first before bringing a university there. We have found out that the reason why we are at 2.9% uptake is that the public does not believe that this thing is in Nigeria. So we need to do mass information, get the truth out there by letting people that have had it and have recovered from it come out and talk on TV. 2, we need to test people and let people know that this thing is out there and my colleague is positive, my roommate is positive, my friend is positive. But I will now know the positive rates in Nigeria. This does not stop the vaccine. I'm not against the vaccine. I'm not stopping the vaccine. Okay. I'm simply saying as you had enough money, as you could get access to vaccine, get access to the PCR testing kit, get access to the RTT. There are cheaper kits now you can do. They may not be completely, or they may not give you positive rates that are very high. I mean, they may not be 100% reliable, but let's start from somewhere.
Okay, Pascal in Abuja. Good morning, sir.
Good morning, sir. How are you doing?
Go ahead, please.
Okay, I want to ask the doctors, is the vaccine, is it free?
Yes, it's free.
Okay. Now, another question is testing free of charge?
It's free in government establishments. Like if you go to the isolation centers, they will test you free.
Okay. Pascal, that you had to ask the question suggests to me that you haven't chosen to take the vaccine yet. Pascal, I was just deducing that you haven't decided yet to take the vaccine if you had to ask if it was free.
I have my wife going to take a test, and I'm paying 39,500. That's what I'm saying. And so I want to find out why is the testing 39,500 while the vaccine itself is free.
Okay.
Because my wife, so as I'm talking to you now, I'm taking my shower now. We're going to Zankli Hospital in Abuja to have a test for her.
Okay.
She's flying in. She's taking off here tomorrow, and then if I'm paying 39,500, then the vaccine shouldn't be. The test is expensive. Why the vaccine is free? So I'm looking at it. There's something that they need to explain to us. Why would I pay 39,500 to test, ordinary test, and then you want me to come and take vaccine free of charge? Why don't I get the test free of charge so that Nigerians can have access to the testing?
Okay, really? Okay, thank you. Now I understand you better. Thank you very much, Pascal.
It's the way we're reaching in this country. We build a road to nowhere. We construct an expressway to places people don't go. And then we now have bad roads in places people go. We just have to think scientifically. You want people to know that I can be tested if I have a fever and I think it's COVID and the doctor says, rule out COVID. Send him to this lab, he gets his test done free of charge. And he knows it's negative, he can now face malaria. But we don't have testing. When we have it, we have to go to the Nigerian Institute of Medical Research or go to somewhere to get it tested free. But you cannot get tested free without being referred. So people want to, if they have the capacity to do vaccination in motor parks, do vaccination in malls, do vaccination in churches, for goodness sake, why can't we just do testing in all these places too? And let people know that they are negative. And when we now know that Nigeria has 90% negative COVID tests, then we can now decide that, oh, wow, this is a great country. Why do we have COVID negative? That can be another reason for research.
Okay.
But we're saying that there's COVID in the country and we don't have tests being done.
Okay. By the way, if you're just joining us, the authorities, government say that they are going to be, start a drive to, take us to herd immunity by the end of January, which will require something like
111 million.
111 million shots. That will take us to around 50%. Right now, our coverage is reported to be somewhere around just under 3%, 2.9%. Elder David in Alimosho, good morning, sir. Elder David in Alimosho, good morning, sir.
Good morning, Yorin.
Please go ahead.
Good morning, Yorin.
Good morning.
God bless you.
Thank you very much, sir.
COVID-19 is real. We thank God in this country. Yes, sir. I say thank you very much, sir. I say COVID-19 is real. We thank God that Nigerians, from what we are seeing in other parts of the world, Nigeria is very lucky. The issue is that, well, we praise this government for starting in the way which they can do it, but I want to suggest then this issue of vaccination, how does it go to the rural area? That is number one. Then number two, then even people in the city, when somebody suggested just now, he even said that he had to pay 500 naira to be tested before he can take the vaccine. There is more problem in this country. What is killing people mostly, and that is, we talk of hunger. It's more deadly than COVID-19 as far as Nigeria is concerned. We don't compare COVID-19 in Nigeria here with what's happening in America and other places because of their own weather. And we should equally involve our native harbor medicine, because the people in the rural area, actually, let me tell you, what is their problem is hunger. If you even carry this vaccine to rural area, nobody will answer you. But if you carry 2,000 and get to them, they will embrace it. Even go to Ajegule now, let me even tell you, put down 2,000 and tell people to come and take this vaccine. They take the 2,000 instead of this, the COVID-19 we are talking about.
Okay.
They are equally making it difficult by saying come and pay 500 naira before you can even be tested before you can take the vaccine.
No. 500 naira. Elder David, I don't quite get that. If you're referring to someone who called in,
and I take it. My
okay.
own brother comes from the village.
Okay.
You cannot see me in my office. Please let the government tackle the issue of hunger and let them tackle the issue.
All right, Elder David. I want to thank you very much for calling in. There seems to have been something of a mix-up. I don't know where the 500 naira for testing came in. Somebody had called in and had spoken about a test, and he was speaking about 39,000 odd. So 500 naira. The complaint when we brought prices into it at all was that for 40,500 or so to get
50,400.
Test 50,000. I think that guy said, yeah. So if it is 50,400, then you can understand why people, will not embrace it. Especially, Adra started the idea of hunger is much more important to people, and if you address the hunger now, Elder David, I think
what he's trying to bring.
Now, Elder David is saying that, look, America did it in some aspects.
Incentivization.
Yeah, incentivization. That big grammar is give them money and see if they won't take it.
Yes, just say, look, if you come for vaccination, you're getting 500 naira. That's what America did. $100, $50 for people because there were some areas that people were really resisting the vaccination. And then they tried to incentivize them by saying, look, come for this and you get it. And what he is now saying is that people are hungry. Let them give them food instead. But you see, we can't give them just food. We have to give them both the vaccination and whatever. So I know it could look very odd, but the truth is, all over the world, you still have to, in public health, you study the public and find out how will they react to this, what will make them want to take this thing. And the simple way out is testing, and then like what you said, the non-pharmaceutical things of masking, social distance, washing your hands, and then keeping away from lifestyle. Now Christmas is coming. I can tell you, Christmas is coming. There will be big meetings. There will be big meetings everywhere. There are carnivals being planned. The carnivals being planned. In the heat of vaccinations, we still have carnivals being planned for Christmas. So we need to come again and ask ourselves, how are we going to take care of this? You
know, it's almost like being caught between a rock and a hard place.
No, sir. In Europe, when the carnival is football in Europe, when they open the stadium, they say to enter the stadium, you must have a vaccination card. They said and when you come in, you'll be tested. If you are playing football, which is a contact game, people are tested before the match. Once a player tests positive, he's withdrawn.
I hear you, Doctor, and as you observe yourself, that Lagos is an environment where it's a work and eat kind of environment. It depends on people being up and about.
Yeah, but we can take care of that by saying, let's test people, let people be vaccinated if they're coming for things.
Okay. Well, we're going to leave it there. We've run out of time, but I want to thank you very much, as always, Dr. Omadeli Boyo, public health expert in Lagos. Thank you very much for coming.
Thank you for inviting me.
We also spoke with Dr. Nneka Onwu, Director of Primary Healthcare Systems Development Authority in Abuja earlier. Thank you very much, Doctor. And also those of you that called in to comment on the on this particular program. Tomorrow is the day of the sort of mass, immunization campaign. Let's leave it here. So see you tomorrow, God willing, with a fresh edition. I am Iyori Folarin. Bye-bye for now.